Hello everybody, this is Dr. Alberto Pinero from BIOS Orthopedic Institute. Today I'm going to be chatting about 5 common mistakes patients make when getting PRP injections. Number 1, ignoring your own health. Remember that when you get PRP or a bone marrow injection, you're actually using your own tissues. So the healthier those tissues are, the better effect they're going to have when you concentrate them and inject them into a target tissue. What do I mean by that? When you have high blood pressure, diabetes, uncontrolled sugar, you're overweight, all these things lead to chronic inflammation. And obviously the way that your body is able to heal is going to go down. So before you get a PRP injection, I think it does make sense to try to regulate and try to get as healthy as possible before you get the injection. So that would include blood pressure control, getting active, losing some weight, making sure your blood sugar's under good control. Number 2, provider due diligence. Remember, not everybody who is doing PRP actually knows what they're doing with it. So make sure you ask these 3 basic questions. Number 1, will the injection be guided by either X-ray or ultrasound? Number 2, what type of PRP preparation are you going to use? Is it leukocyte-rich, leukocyte-poor? And number 3, do you have a cell counter? Do you know specifically what platelet dose you're going to inject into me for this specific problem? If they can't answer any of those 3 questions, then you know it's time to go somewhere else. Number 3, underestimating the pain. PRP and bone marrow or even micronized adipose injections can be quite painful. Whether you get it into a joint, a tendon, or a muscle, all of them will have some variety of pain. Most of the time, joints tend to be better tolerated. Tendon injections can be more painful. What I mean by that is that don't get the injection and expect that in a couple days you're going to be better. You're actually likely to have more pain for a while, and with tendon injections, it could take 2, 3, even 6 months for you really get better from the injection. Number 4, not doing your rehab. Physical therapy is a key part of getting better after a PRP injection. As I mentioned, these injections can be painful at times. Therefore, you got to go through 3 basic steps. Number 1, restoring your range of motion. Number 2, getting your strength back. And then number 3, doing a modified return to activity program. A lot of people think that they're just going to get the injection and they're going to be just fine. Most of the time, you want to really commit to a good rehab program for 3 to 6 months after the injection. Number 5, unrealistic expectations. Yes, these are called regenerative therapies, and in some cases, they can actually modulate the disease and actually fix your problem. Osteoarthritis, that is a chronic disease, very much like high blood pressure or diabetes. So PRP in these settings is going to bring down inflammation, reduce pain, let you be more functional, but it may not be actually curing the disease. Also, if you have, for instance, bone-on-bone arthritis, these injections are not going to unbone you. So in conclusion, make sure you don't make these common mistakes. Whenever you're inquiring about getting a PRP or a biologic injection, make sure you follow these 5 general rules.